We'll get started. Welcome everyone, and thanks for being here for this April 21st session of the PT Cross Canada Checkup. Now, these sessions are really designed to connect physiotherapists, colleagues, and friends from around the country, and really to provide a community where we can support each other through these difficult times. So the sessions are also, they're designed to stimulate discussion and keep us all informed on the initiatives and resources and research that's related to COVID-19. And really, as the sessions have progressed, especially the ones that we're doing on Thursdays and Sundays, where we can stimulate a lot of really good discussions with people and connect with colleagues from around the country, we've noticed that one of the most important things that we're getting out of this is that dialogue and really connecting as a community and supporting each other through some of these difficult times with COVID-19. So just before we start, I wanted just to tell all of our colleagues in Nova Scotia that we're all thinking of you, and that really during this time, we're all, us within the Cross Canada Checkup team, as well as the colleagues from across the country, we're all thinking of you and supporting you during this difficult time. So during these, and really in any way that we can, we'll try to continue that support with everyone across the country. So if you're new to these sessions, what we normally do is we'll have Mike Landry goes through a little bit of an update on some of the things that have been going on. And then we have a great guest speaker today, Alice Aiken, who's in Halifax, Nova Scotia. And we'll hear kind of about her experiences. And then we'll open up the discussion at the end for a good Q&A with individuals from that are participating. And in these sessions with the CPA, what you'll do is you'll type in your questions and we'll read them out. And then Alice will have a chance to answer them that way. So Mike, I'll pass it over to you.
Great, thank you, Phil. And let me share my prayers and thoughts for all the families who've been affected. Not only are we as a global community managing and looking through COVID-19 as a pandemic, but when this happens in a very small community, it's devastating. So all of our hearts and prayers. Today we have usually I do a little, as maybe more for Dr. Aiken, a little bit of a sort of rundown of some of the numbers. We've sort of stopped that. They're so large at this point. That as of today, it's surpassed 2.5 million people who've been infected by COVID-19, and a tremendous amount of so there you go. There are some numbers out there, and I'll leave all of our colleagues to go and check out the Public Health Agency of Canada, the World Health Organization, which are, in our opinion, some of the more strong data sources that you can get, and at very minimal, they're reliable. Today, everybody, friends, we have a real special guest. So I'll just say a few words about our guest today, and then we'll kind of go into a discussion, or a little bit of a discussion between Dr. Aiken and myself and Phil. And then we're really going to try to stop sort of the formalities, if you will, somewhere around 7:30, and allow some questions to kind of come from the folks who are participating. And I can see here we have 73 participants. So thank you and 74. So thank you so much for participation for today. So today our guest is Dr. Alice Aiken. Alice and I have known each other for a fair amount of years. There's at least a couple digits there. And I remember when I first met Alice at Queen's, actually. It was a Ontario Physiotherapy Association conference. And, when you first meet Alice, there's no kind of going back, or you can't sort of think. And her career has been an amazing trajectory to watch, from clinical physiotherapist, a member of our armed forces, through to faculty, to a dean, and now a vice president of research at one of the top universities in the country, at Dalhousie University. And so she brings an amazing wealth of background. She also many of you will know this, but established the Institute for Military and Family Veterans. I practiced the name, and I'll let Alice kind of tell us the actual name for the Institute, which is a very important infrastructure now across Canada. Alice, welcome to the show. So pleased that you could be here with us today.
Thanks, it's great to be here.
And I'll kind of fast forward a little bit. One of the reasons that we invited you to come and share your personal experiences today was because you shared with me and others that you yourself have contracted COVID-19, still on the recovery path. And so for us as colleagues, but also as scientists, researchers, clinicians, hearing firsthand from somebody like you would really be an amazing opportunity for us to learn, not just what it feels like or what it is like, but certainly what role you think the physiotherapist can play into the future, given your contributions, of course, to developing let's welcome again, and let's start with a few things. But tell us a little bit more about yourself, a little bit more about your career, and sort of what took you to this position of VP of Research, just to get a little bit, just to know you a little bit better.
Yeah, sure. So I wanted to be a physiotherapist coming out of high school. Like many of us, didn't at that time. I think you could get in as your first degree. I did not. I did a kinesiology degree and ended up. I had joined the Navy the summer before university started, the Naval Reserve, and did that through university. And when I got out, I joined the regular force and got accepted into physio school at Dalhousie, and they agreed to pay for it. I was a ship's navigator before that, proved my point, and then didn't want to do it for a career. Got into physio at Dalhousie, and the military paid my way through school, which was great. And when I finished, I got posted to Kingston. Served 4 more years in the military in Kingston, and then when I released, I went to run the physio clinic at Queen's. I'm noticing several former students in the attendees, so that's lovely to see, and Phil. And while I was running the clinic there, I did my master's and my PhD part-time and started as faculty there. And as Mike mentioned, had the really good fortune of connecting with the right people and starting the Canadian Institute for Military and Veteran Health Research, which remains to this day a very important institute in Canada. It's still, I am involved in that. I am a researcher and I'm a fellow of the institute, but I no longer run it. And then about 3.5 years ago, I came to Dalhousie to be the Dean of the Faculty of Health. And the Vice President Research left in my first year there. And so that was the dream job. Ever since I started as a professor, I have loved research. And so I went for it. And now I'm the Vice President of Research and Innovation. And I'm sure, as you can imagine, in these times with the pandemic, we've had to shut down all of the university-based research and the field work. It's been very challenging, with the exception of COVID-19 work. So it's been very challenging these past few days or weeks.
Thanks for that. Alice, how do you think this will move forward over the next few months? Nobody has a crystal ball. But given what you're seeing at the top universities in the country, how do you see this affecting physical therapy education, or even higher education in general?
It's interesting. I think that there's a timeline to that. So in the immediate future, I think a lot of people are wondering, especially in the PT profession, am I going to be able to do my clinical placements? And, if they're in education right now, or are we going to start face-to-face classes again in the fall? Because I'm sure we would all agree there's a lot of PT education you cannot do virtually. So I think everybody's working on that and deciding right now. I would say people are hopeful that there would be at least some form of face-to-face education, even if not all of it. Some of it might be virtual and some face-to-face, practicing social distancing. But for our profession, that we don't social distance. It's not how we practice. And I've seen some very clever posts on social media about how people are working with their patients from a distance, but it's not everyone who can do that. I wonder too now if we might not have a bit more focus. I think the numbers are 60, you guys can correct me if I'm wrong, around 60% of the profession is in private practice. And I'm wondering if we may not see a little bit more of an interest in the new physios in staying in hospital and working more in chest and trauma and cardio resp in areas of care that would be in the hospital. And indeed, those people are still working, right? It's very critical areas of care that are still needed in the hospitals. Oh, Mike froze.
I'm here.
Oh, okay.
I'm back.
Okay.
Sorry. Well, thank you for that, Alice. Yeah, I think, let's see how this plays out. And I'm not sure if 60, my assumption was a little bit higher than that in the aggregate across the country. But nonetheless, there are private practitioners out there who, the next few months is going to be difficult. And, let's give a little shout out to the CPA and their lobbying efforts around, which I know you also around looking forward to supporting physiotherapists around the country during this particular time. So Alice, maybe, drilling down just a little bit more, but tell us a little bit of how your life has been over the last 2 months or so, and sort of what's been your experience through this trajectory of COVID-19?
Yeah. It's interesting. I was supposed to actually go to Japan for work March 6th to the 13th, and the meetings in Japan got canceled a week before I was supposed to leave. And so I looked at my schedule with an entire week of no meetings, and my husband and I said, oh my God, let's go south for a week, right? No meetings, yay. So we booked a last minute vacation to Jamaica, and in hindsight, that seems so ridiculous, but even then we really didn't know what was coming, right? And so we went to Jamaica for a week. We came back through Montreal to Halifax, and that was when everything had started. So we arrived back on Saturday the 14th, and on Friday the 13th, Dalhousie had said, if you've been out of the country, you need to self-isolate for 2 weeks. And it was just before the province had done it. And so I wasn't even sure. I was still like, oh, do I really have to do this? I don't know. But we did, and thankfully we did. About 5 days after we got back, my husband started experiencing some symptoms. And about 5 days after him, I did. I also have rheumatoid arthritis. So because of my medication, I'm immune compromised. And so when we went on, when we called public health, you have to do a little online thing here. And then when we called public health, they got us in right away for testing, very efficient. And then they follow up with you for the entire, for the next 10 days just to check your symptoms. Mm-hmm. So it was interesting. My husband had body aches, fever, headache, did a lot of sleeping. I felt very, very lightheaded, completely lost my sense of smell and taste, and was extraordinarily fatigued. Like I was just sleeping like crazy. It was the smell and taste though, and we were sort of just hearing rumors of that, and they still haven't put it down as an official symptom, but in talking then, I've since, the advantage of being at a great university, I've since talked to about a dozen infectious disease specialists, and my nose wasn't stuffed. It wasn't that kind of no smell and taste. So I'm thinking it's somehow the virus is affecting cranial nerves. But anyways, so that was very interesting. I took a bit of time off work, about a week of light meetings, and now gradually recovering. I'd say I'm not able to do my full workouts again yet, but I'm getting there, and I'm sleeping a lot. So, but I don't know, that could just be working at home.
What did the recovery feel like? So, progressive, you felt more energy, but was there, just curious, and we talk about this being mostly respiratory, attack. So from a like chest perspective, mobility, like how did you feel about that? And
Yeah, so nothing, I had no chest symptoms at all, no cough. I still don't. And I don't imagine I will. They don't think we're contagious anymore. Um, but I did, I started to get a bit of a flare of my RA symptoms. So, and that's sort of a noted thing, you know, the Arthritis Society and stuff are always in touch with you. And I guess that's a noted thing. But I've been able to get that under control, and thanks to one of our own, Diana Perez, who is a physio out of Montreal, who was on the board with Mike, CPA board with Mike and me at the time, and Diana does yoga online and puts us through our paces. But oh my goodness, it was extraordinarily helpful. So I relied on a physio to get me moving.
well, that's a good entry point. So kind of your reflections in terms of, you know, roles of PT. I mean, obviously, or maybe it's not obvious, but patients can experience quite a wide range on the severity scale in terms of, you know, COVID-19. The most severe of which would require ventilation, you know, high resource intensive. The most mild may have different levels of symptoms. So, you know, thank God you were sort of on the sort of, let's say, that end of the scale, if you'll permit me to say that, although I'm sure it was very, very difficult. But kind of how would you see the role of health workers and maybe PTs in particular along this pathway?
Yeah, and I'd really like to give a shout out to Vivi Reeson, the CPA right now. I think Vivi's leading a good ship here in helping us to get our feet under us, lobbying the third-party payers. I don't have to tell anyone on this call, and I worked clinically for 12 years. Our patients get very attached to us, right? And I think for a lot of our patients, that check-in, it absolutely can be done virtually. And I'm sure people have figured out how to do new assessments that way. I mean, I haven't practiced in a while now, so that's not my thing. But, and I think more than anything, to just say no, and we're taking away this health provider is, I think, very difficult on patients. We do provide a very valuable service, and we can check in. There is a lot we can do via telemedicine. I also think the other thing that we can't forget is we're regulated health professionals. There's calls out in almost every province right now to get people into the hospital, anyone into the hospital with a health background who can help. And I think if people are willing to step outside the box and just say, okay, for now, I'm not working in X clinic, or I'm only doing, my caseload's down, I'm only doing it part-time, but I'm going to go in and I'm going to help with testing, and I'm going to help with the public health, with doing follow-up on the calls and all of those things. I think we really have an absolute role to play there. And I think sometimes the health system forgets that we're another regulated health professional who can do all of those things. We all have the background and training in that, right? So I think that is a great way to position things and a great way to go if people are willing to do that.
On some of our previous shows, for instance, Patrick in Ontario, actually it's where Phil was as well, sort of quickly reorganized, retooled themselves to provide that service to the local hospital. And so I think, being flexible, nimble, isn't that what we do? Can't we problem solve, right? And so I think I completely agree with you. Now on the policy side, we also know, and CPA sent a message out around Quebec, which, has a roster, but some of the PTs are not really being brought into the fold. And so there's additional, lobbying that's going to hopefully go on with OPPQ and AQP over time. But you're right. I mean, we also need to record this, right? And really demonstrate the efficacy. And what Phil and I do is a lot more on the early side of the emergency. But we're now moving into a little bit more of the longer term part. So completely agree with you there. I can't, I'm sure among our 91, oh my goodness, 91, man, we hit the record. Like, is this like a thermometer or something? So let's open it up for some questions at this point. We certainly have more, but I'd love to hear from the folks who are joining us. And just to remind you all what Phil had said, you unlike the other days, you have to go to the chat, or the Q&A rather, and just hit your question. We'll read it off, and then we'll
Freeze.
Let's see who's on the. Okay, let's wait for the first question. Here we go. Usually it's a moment or two, you know.
Will it be in the chat or?
Go to the Q&A.
Okay.
And well, while people are thinking a little bit, let's maybe ask you from the military perspective. You know, where do you see their role? And this is something that's sort of come up. I mean, the Prime Minister has talked about how the forces will be deployed in northern Quebec and parts of the country, maybe in particular for our rural you know, communities. But you know, we all need to play a role in this. But you know, given your background, what do you think in terms of what the role of the military could be in this?
Well, I think we're seeing the military. You know, the military has been called into Quebec to help in the nursing homes. And that might be another area where physiotherapists who aren't typically there have a role to help in care homes, where staffing can sometimes be challenged by contracting COVID-19. And agreed, fully provided proper PPE is provided. You know, everybody needs their personal protective equipment. You know, the military was called in there, and sadly here in Nova Scotia, not related to COVID-19, but the military has been called in to help with the investigation of the shootings. But, you know, when I was in the military, we were, and if there's other military practitioners on the line, they'll back me up on this, but in a crisis situation, everybody's pulled in to help however they can. You know, first and foremost, you're a member of the military. So, for example, when we were getting people ready to deploy, when I was in the military and we were getting people ready to deploy to Rwanda, and it was happening very quickly, we, you know, I went and worked in the pharmacy for a while because we just had to get medications out to people to get going. So, you know, I think what the military will do is step in wherever they're needed, as they always do. And if you're a health practitioner, the difference in the military being, of course, you are not personally liable, right? They can only sue the government. They can't sue you. So they have the ability to put you into any role they want you in.
Yeah.
So, yeah. But it's very interesting. I think we'll see more deployment of the military, and as always, they will be ready to go and be there.
You know, I wonder, and I see there's some questions, so maybe I'll tee up Phil to get ready with the first question there. But they're continuously being prepared, so they do simulations and there's rostering. And, you know, I think Phil and I will be kind of lobbying a little bit among us, CPA and beyond, to think about how we might have a core of providers who would be trained and ready to be, to facilitate, you know, because, you know, this has taught us a few lessons around resource allocation. So, so I appreciate your point. Phil, let's pass it to you for this first question.
Yeah, sounds good. So thank you. Thanks, Mike and Alice. So there are, I just wanted to bring up that there are a lot of comments coming through on a lot of your former students.
Yes.
And people that are saying that they're happy that you're feeling better and wishing you the best. So I just wanted to pass that along because we have had quite a few comments about that. Now there was one of the first questions that came through from Amy. And I'll ask the question, but it might be related more to international guidelines and that. But one of the questions was, so if clients have been diagnosed with COVID-19, what are the guidelines or recommendations on exercise and mobilization? Should they be encouraged to move? So I'll pass that on to you. And then the other thing that I'll even add on to that is if that's more of international guidelines, and that is from your experience, what have you noticed, and where do you think that we can have a role as well?
Great. So the treatment's symptomatic, right? You're treating symptoms. There is no other treatment. So if the person, it would be like if somebody has a flu or a cold, would you want them to move? Well, it would depend what their symptoms were. So for me, because I was very lightheaded, I generally do a lot of yoga, and I wasn't able to do yoga because I couldn't bend over because I was woozy. And if I'd been able to leave my house, I would have kept walking, but I wasn't allowed to leave my house. So, I think it's symptomatic. What I would say is, obviously nobody's seeing them one-on-one. You don't want to go see them directly if they have COVID-19, but really you just want to, it's symptomatic treatment. So if they feel like they could move, I would say, yes, keep them moving as much as they can, and as much as is healthy.
Okay, great. Yeah, thank you. And that's really, really useful, I'm sure, for everyone, especially to get it from someone who knows both from a research perspective, but also who's experienced it. Now, the next question is from Deepak, who asks, so how does research in physiotherapy in post-COVID, how would that change the direction of the profession?
Yeah, that's a fantastic question. We have a lot of COVID-19 research going on at Dalhousie. I mean, generally, not specifically in PT, though there's some related. I will talk about that. So my ongoing role in COVID-19 research is that I'm a study subject now for all of the blood studies happening at Dalhousie. So my role is a very different one. But we do have, like I said, they're noticing, or there's some theories now. They want to look at the ongoing lung damage, and potentially there could be some good cardio-res research there for the profession in terms of lung capacity and lasting effects, which I think would be very interesting. And also, and the infectious disease doc I was speaking with on Friday, I said, I feel like it might have affected my cranial nerves, which is why I lost my smell and taste and wasn't stuffed up. And they think that that's probable as well. So there may be some good neuro research there we can do as well. Right now, I don't think there's any physical effects per se that they're noticing. Other than that, as you guys know, the longer that you're bedridden, the more immobile and the more wasting you get in your muscles. So that's more on a treatment side. I think we could bring people back, but I suspect there'll be some very interesting neuro and cardio-res research that could come out of this. And in fact, one of our physios who does neuro work is looking at doing some work right now with COVID.
Okay, great. Yeah, thank you. I know, a lot of potential for research. And I know maybe, Mike, you can touch on, there was some research that came out initially on the ability for it to cross the blood-brain barrier and the olfactory system. So I'm not sure if they've done much more on that, but yeah. So we'll go, Mike, you can jump in if you'd like. If not, we'll go to the next question.
Okay, yeah, we'll do the tandem here. Alice Krista says, hi, Alice, thanks for joining. When you were recovering at home from COVID, so this is hypothetically, if you had a physio you normally worked with, how would they have made you feel supported? So maybe, and regular check-ins, phone calls. So, let's say, like, I even started by saying that you're like one of the most amazing people in the world. So, but you also have and all of us here have an ability to kind of figure things out. But what about a patient who might not, right? Somebody who's really scared. So in those cases, what role could a PT, maybe online, telehealth or something, how could you have been supported if you were different?
Yeah, and I think it's a great question. Thanks, Krista, and a great point, Mike. When I got sick, I wasn't afraid to move as much as I could, because I understand what's going on. But I think for a lot of patients, and this, tell somebody who's never had back pain, they have back pain, and the first thing they do is stop moving. So tell somebody they have COVID-19 that could kill them, and they're going to stay in their house and they're not going to do anything. Now, staying in the house is not optional, but you know, I think physiotherapists have a very supportive role to play. And as I said, our patients generally trust us. They tell us everything. And, you know, I think just a supportive face and somebody to say, you know, you can keep moving. It's important that you keep, depending what the situation, imagine they just had a knee replacement, right? They need to keep doing their exercises. You need to keep coaching them on doing their exercises or they're going to seize up. So I think that it's not just a supportive role. It's really a coaching role, an educational role, and keeping them moving.
And maybe
Oh, Mike, you froze again.
for the my back.
I can
Hi,
hear you.
am I back now?
Yeah.
Yeah. If I'm back, just wondering, just to add to that, Alice, you know, part of CPA are physiotherapy assistants, and so, you know, surely in a role of a big public approach, you know, there's roles for multiple, you know, participants in our framework. So I think, you know, that would be important to add. Now, here's somebody you've never met. So Alice Hopkins Roseal asks, could you reflect? Reflect for us on respiratory physiotherapy and why we do not promote it in our private practices as well. We'll take the first part like that first. So, you know, why don't we promote it in private practice, do you think?
Right, and you know what, Diana, it's a great question, and I absolutely think we could. And just to, you know, I believe if we did cardiac rehab in private practice, we would have clients. I believe if we did chest care for people who are compromised in private practice, we would have clients. I have no doubt that is a very good direction we could go. I'm not sure why we don't, Diana. It is a really great question. For sure, to your point, like after discharge, secondary prevention, all of that, it absolutely could work. I'm not sure why it has never taken off in private practice. It's a great question. And, you know, I think I would welcome other people's opinions as to how we could make that happen. I also think we should be doing neuro in private practice. But you see a little bit of that, but not a ton. And it's usually, you know, like a physio who goes to a patient more commonly rather than a clinic setting. Great question.
Paula Kalnan, a former Queen's student, I hope I pronounced her name properly. Do you feel your rheumatoid arthritis flare-up has settled down since recovering, or are you still in a flare-up? So maybe tell us a little bit more around the interactive effect with Ray.
Sorry, Mike, you're cutting out. So I don't see the question, Mike, and
Phil, take over.
Go for it. I think you're back. I'm going to try to find that question there.
If I'm back, I'll just, basically the question was around your rheumatoid arthritis, and maybe tell us a little bit more of maybe, you know, how you felt that complicated your scenario, or maybe it made you more aware.
Yeah, no, I mean, I definitely got the COVID symptoms and then started getting the sort of bilateral joint pain. It wasn't a full flare. I wasn't red. I wasn't any of that. And I think, in fact, just my word, answer the question, I think I have recovered from it. You know, it was a short flare. I didn't have to take any extra medication or anything like that. And like I said, it was getting back to yoga, which is something that keeps me, I think really keeps me moving. I'm still having some trouble with my right wrist. So I don't know if it started with that flare, but also my work setup at home isn't as ergonomically sound as my work setup at work. And so that could be part of the right wrist still hanging on. But other than that, no, I would say it's gone back. But again, it was yoga and good old Diana Perez putting me through my paces.
Nice. So Mike, I'll jump in and just ask a question here from William Harvey, who asks, so having a role in academia, do you think this will prompt a shift in entry to practice training to include instruction in telerehab?
Geez, it's a good question. You know, I'm not sure any practitioners get instruction in telerehab, do they? Are you familiar with that at all? I'm not sure that any health practitioners do that, but I mean, we're a smart and thinking profession. What it really could mean for us is how could we think about what it means to do our practice remotely? We live in Canada, right? We're not inventing rural and remote practice. It exists. So how could we think about incorporating it more into our practice? I mean, I think we pride ourselves on being hands-on. And so there's a lot we can do without touching our patients. And so I think that's something that we could think about. And, I don't teach in a PT program anymore. But that would make sense to me to start thinking about people, if another global pandemic comes, what do we do? What's our role? It's scenario planning, which we should all be doing all the time.
Yeah, absolutely. And we've been talking a lot on, even in these sessions, how although there are a lot of negatives that are happening, there are also some positives that are coming out of COVID-19. Like, it is accelerating practice in a lot of ways. So I think even in terms of what you were saying, like accessing and providing care in rural and remote parts of Canada is something that we've been trying to do for a long time. And hopefully we can learn from some of this and really accelerate that and bring it forward.
Yeah, we're going to come out into a different world. And I think everyone's going to be required to do what they do differently. And if we're ahead of the curve and thinking about that, and that is the future. People are going more and more online. There's people in their 20s who don't see any practitioners face to face. They do everything online, right? So, I think we need to adapt to that.
Yeah.
Not suggesting we should do all our practice that way, but what can we do that way?
Yeah, absolutely.
Yeah. Even what can we teach that would be as effective online to lower some of the costs? And so, yeah, I agree. I think there'll be some real changes in how we do things. If there are some other questions, Phil, I'll let you take it maybe in case I drop out.
Yep. Sounds good. So there's a question here from Karen, who asks, so for the recovery for patients who have been immobilized due to being ventilated, should the plan be to treat as if it's a chronic restrictive lung disease? So not sure if you can touch on that too much, but do you have any insight on treatment of that?
Yeah, so I don't know. My guess would be yes, that it would be. Like I said, when you're active with COVID, the treatment is symptomatic. So afterwards, I guess it would be what the lung profile looks like. I don't know if anyone else has heard what the lungs look like following COVID, but if there was lung damage, I would imagine you would treat however you would treat that. Sorry, I always did ortho in sport.
Yeah. And even kind of drawing on some of the stuff you were saying earlier, like drawing on the research that's coming out and how important that is, and also drawing on the expertise within our own profession here in Canada at all stages. So
yeah, but really I think it'll be a lung profile. But we've been through other sudden acute respiratory syndrome, SARS viruses, right? This is SARS COVID-19. So we've been through that. So I think, however that was treated would be, and if it was effective, that's what we would continue doing.
Yeah, absolutely. Yeah, so we actually have a lot of questions today. I think this might be the most we've had. So we'll keep going through. So Sandy Rennie asks, so hi Alice, you mentioned that maybe after this, more physiotherapists might want to work in hospitals. However, across Canada, PT positions in hospitals are being eliminated. What can we do to help maybe bring them back?
A great question, Sandy. You know, I think one of the things we can do, and I say this in the spirit of never waste a crisis, but get out there in droves and show how we can help during this crisis and our value in the hospital. And because that's where the crisis is being borne out from a healthcare perspective. So get out there, show our value in the hospital, and let's reaffirm what we actually do for others. I noticed one of the earlier comments from Amanda Deschasseling said that the government requested the military and physician specialists and nurses. You know, and a seniors facility would have been perfect for physios to go in as well and get the ones who aren't sick up and moving and keep them from getting sick, right? I think we need to really advocate for ourselves to be there and be on the front lines and show our value, and that may bring the positions or help bring the positions back.
Yeah, I really like that point about really showing our skill set in all of this. And you actually just mentioned Amanda, and this leads really well into a question that she had. So she says, so obviously many politicians overlook the skill set and scope of practice of PTs and other healthcare professionals. How do you think our profession can most effectively address this gap in knowledge from policymakers and government members who don't have any medical backgrounds or personal experience with our profession?
Yeah, so if you guys will permit me, you know, I do everything I do as a physiotherapist, right? There isn't anybody I work with anywhere who doesn't know that I'm a physiotherapist, and I'm very proud of that. But I think one of the things that we do is we try to tell people what we do versus how we can help the patient or the symptom, or the system, or the, you know, how we can help inform policy. We come in from but we're physio and we're great, you need to hear what we do, instead of oh, you're having this problem with the health system right now, here's how we could plug into your problem and help out. You're having that we're seeing a lot of cases of this. Here's how we can help you solve that. We tend to come at it from well, we're great and we should be doing that and we know how to do that and you should listen to us, instead of coming at it from let us help you, let us show you how we can help the system, let us show you how we can help solve your problem, let us show you how we can help the patient. Patients are better because of us. We tend to come at it from the wrong angle. We advocate for ourselves instead of advocating for the Canadian health system, Canadians themselves, and policy making. And so I think that that's the way you come at it. And you know, and I think since I was president of CPA, I mean, it is what we tend to do. Because we are a bit misunderstood, and it's a natural reaction. But I think we really need to revise how we approach government. It needs to be from we're here to help. This is your system problem. This is what we do to solve it. You know, or here's our solution. Like right now, stepping up, going into the hospitals, getting on the rosters, getting in and helping.
Yeah, I can see Mike wants to jump in, so I'm going to let him go ahead first. But
yeah, well, my internet is not super stable, but let me try it anyway. And you know, kind of trying to connect a couple thoughts here. One, the altruism to want to be part of a solution, and yet on the other side, we're you know, regulated health professions. And the military part as well. So, you know, the military, you could school us a lot more here on this one, Alice, but, you know, you prepare in the military, you prepare, and then you wait and you wait. So, you know, that's also an important aspect, is that we're prepared, you know, from a training perspective, And so when called upon, you can easily move. And so I think the preparation is in part that probably we'll think about differently in the future. But I think that's an aspect. Let me try a question here, and this is a really easy one. It's from Jason Coolin. Alice, thank you very much. I just wanted to get your perspective. I'm being facetious here. Where does the balance lie for the CPA between mobilizing PTs into public practice or rostering to address gaps related to COVID, and the need to support private practitioners and clinic owners who are struggling? So, you've been the president of CPA. I mean, you understand the complexities that Vivi is living through, and so do I. It's not easy, but because you always have to be balancing. It's not a, if as presidents, and I know Sarah's there, we used, everybody got the quote, like, if you did this one thing, everything would be okay. And of course, it's not that. So tell us a little bit of your perspective of how you balance these things.
Yeah, and it's both, Jason. To answer your question, it's both. And I do think, the CPA really needs to be lobbying the third-party payers about what PT can still do for their patients and why they should not be cutting off payment just because we aren't seeing people face-to-face, or practitioners aren't seeing people face-to-face. Absolutely. And then when the reality, and then in this situation as well, if there are people who aren't clinic owners, or, the clinic owner feels they're the only one who can stay working, or they have to cut down the workforce, then go and roster and work in the hospitals. I mean, I think we need to promote both. There's no sense going to Health Canada and saying, you know what, or any of your provincial departments of health, and saying we need to keep third-party payers paying physio. They don't care. They're facing a tsunami, and we're offering them a rubber dinghy that is of no use to them. That, for those people, we lobby for what physios can do in hospital. To the insurance companies, we need to start pushing and saying, you want to keep people out of hospital. You don't want people with chronic illness. It's going to cost you more money. What you want to do right now is you want to pay for us. So it's not an either or, it's a both and. Absolutely, Jason.
Thanks. So I'll jump on for the next question, and Mike, unless Mike, you were going to comment on that. Yeah. So I'll jump in, but I just as you're speaking, it's I know I'm learning a lot, and even when you're talking about policy and really being aware of the audience and how you're presenting that and how important that is. So I really appreciate the fact that you're mentioning that as well. Now, the next question we have was from Diana Hopkins-Rossile, and her question is, what about disability research, i.e. the effect of COVID-19 on individuals with disability? So what are your thoughts on that?
Yeah, absolutely, Diana. I think Diana was just pointing out something I missed, but you're dead right, Diana. I think that it's going to be interesting, because it seems right now that for people, even with not necessarily a disability, but with a comorbidity, that when they recover, they recover. So, I think it will be something interesting to watch. And I don't know that there's a ton of research out there on it right now, but it will be a good area to watch.
Yeah, absolutely. So yeah, definitely an important piece in where we can fit. So the next question that we have on here.
Comment is just to whoever said it. For all of this, I'm representing my own views, not the views of Dalhousie for this entire talk. Oops. Sorry.
Okay. Yeah, I saw that comment come up. So I'm glad you touched on that.
I think you're doing a great job, Alice.
Yeah. So the next question, so we have Patrick, who's in Renfrew, just down the road from where I am. So do you anticipate that the core competencies for physiotherapy admissions will change or evolve as a result of the pandemic? And then the next question related to that. Will this force universities to change their curriculums? So admissions as well as curriculums.
Yeah, it's a good question, Patrick. You know, I haven't been directly involved, even though I'm part of the PT program at Dal, because I came as a dean and I'm a VP now. I'm not directly involved in admissions or curriculum anymore. So I'm about 4 years out of the game now for that. You know, from my perspective right now, and this is just my perspective, look, the admissions requirements are so tough to get into physio anyways. I don't think we need to change anything. And I think we teach it all in our curriculum. I think and you know, I know from coming from Queens, our cardio rest curriculum was fantastic. The neuro curriculum was fantastic. I think a lot of people still come in with the interest of doing orthopedic and sport work. So maybe what will change, I will offer, is that there will be more interest from the get-go in some of the other areas of physiotherapy as well as orthopedic and sport. But that's just my opinion.
Just mindful of time, we have probably enough to get more questions. I'll read, and Phil, you take the next one. I think that might get us to the 8 o'clock, and I don't want to take any more time. Alice, this is from John Spiru. Hi, Alice. Great to see you. Thanks for sharing your story. Quick question about the relevance of PT during the pandemic. Could this be an opportunity to perhaps rethink the 20-year vision for physiotherapy to include more controlled activities that could make us more relevant to the public? For example, having authority to order lab work, imaging. Curious to get your thoughts.
Yeah, so listen, John, I mean, you know, I did all my early research in the role of the advanced practice physio. I came out of the military doing a ton of things that I wasn't then allowed to do as a civilian. You know, do I think we have more capacity? Absolutely. How the profession approaches that for adding it into practice is up to all of you guys, right? But I think we have capacity beyond what we always do in practice? 100%. Should we be advocating for that? 100%. You know, and very kindly, I still have colleagues who are doing advanced practice work who still bring me into that research. You know, I'm still touching it as well. I still have a very active research program. And so of course, 100% we should be advocating for everything we can do in and for the system. Again, coming at it from the perspective of, this is what's best for the patients that you're bringing into the system, because we don't cost as much as a specialist, and we can provide fabulous care, and we're more accessible. That's my point.
Yeah, great point. So I think, yeah, we'll have time for one more question here, and then we'll kind of wrap it up. So we'll go to this question here from Michelle Sinclair, who says, could I chime in that? So, well, more on the role of the association. So it was a question of how to get physiotherapists in positions in hospitals. And in Alberta, we were being replaced by large numbers by PT assistants and other professions like OT and RT. So maybe the role and how we can show our value within hospitals. I think you kind of answered that a little bit, but if you wanted to touch on that.
Yeah, I think what we need to do is show how our value to patients, not our role in hospitals. So what's the value to the patient of having a physiotherapist treat them? Not the value to the hospital of having a physiotherapist there instead of an assistant or an OT.
Yeah, okay. So really focusing on the benefit for the patient.
Yeah, yeah.
Now, Mike, did you see another question, or wrap it up there? There's so many here.
Well, I'm looking at the questions too, and I just noticed one from Sandy Rennie following up on John's question.
Okay.
Would the regulatory bodies in Canada, might they allow more advanced practice and specialization? And I will say, yes, let's hope so, and they should. And I will tell you all, and this is just my opinion, when I came here, I still hold a license in Ontario because when I retire, I want to go back to clinical practice, part-time. But I still hold my license in Ontario because when I came here, the hoops I would have had to jump through to get licensed here were kind of crazy. Plus, I would have had to take a non-practicing license, which I still do research in the area. I don't consider myself non-practicing. So that's just my little sidebar political commentary that I think absolutely we need to be thinking about our regulators and what they are and aren't doing. I mean, are they really protecting the public? I was the dean of the faculty where I got my degree, and they wanted me to get my original transcripts. Like, do you think they didn't know I have a degree? Like, it's crazy. It's crazy. anyways, done with the rant. I apologize if I offended anybody.
No, that's okay. We welcome all of those in any of these sessions. So thanks for bringing that up. Now, I think we'll wrap it up there unless, Mike, you have another question you want to cover. But one of the things that I did want to say is this is probably the highest attendance that we've had in one of these sessions, and the most interaction and number of questions that we've had. And I did just want to bring up, so as the questions are coming in, not only were there questions, but there were also a lot of comments just saying, well, first of all, that it is really great to see you and that you have been an instructor, a teacher, and a mentor to many people across the country and many people that are in these sessions. And there were so some comments just to thank you on your leadership, as well as the leadership of Diana, who you mentioned, for doing the yoga sessions. Thanks to the CPA and VB and JP, and Simone at the AQP and the PTs in nursing homes. So I just wanted to bring that up as well. The last thing that I'll bring up, and then I'll pass over to Mike to really wrap it up, is that as you were speaking, and I know that I was feeling really empowered and motivated by what you're saying. And I think just the way that you deliver everything is really powerful in showing the role of physio, as well as just really getting everyone excited. And I did see there was a comment here. I have no idea at what point, but there was a comment that said, on that point you just said, yes, with around 15 exclamation marks. And I think that's kind of how we're all feeling right now, and how we feel after you speak. So I did just want to take this last opportunity to thank you for coming in, and thank you for your leadership during this time, but also through all, for all of us as physiotherapists in Canada. So I'll end it at that, and Mike, I'll send it over to you.
Yeah.
Can I make one quick last comment, and we'll wrap it up? I saw all the kind messages coming through and from former students, and it's so great. And thank you. I always remember all my students' names. I know who you are. I just never remember the year you graduated. So thanks for putting it in there. I appreciate it. But it's so great to hear from you. So great.
Yeah, thanks. I think, Mike, you might be frozen.
I'll just, as an educator, there's probably am I frozen?
No, you're good. You're back.
Okay. Yeah. So listen, I thank you, Alice. As an educator, there's no greater compliment when a student from years gone by comes back and says, I appreciate you. So but let me just echo what Phil said and what many on the line said. Thanks, Alice. Stay well, get better. We love you very much, and thanks for coming on the show. And thanks to all the attendees who spent the evening with us. Go and make a difference today. Alice, thanks.
Thank you. Thanks, guys. Bye.
Bye.